hardest things to do is grieve the loss of someone that is still alive. But according to the Alzheimer's Association, this is a reality for about 5.8 million Americans living with Alzheimer's and their families. Today, I'm talking to you about Alzheimer's disease. The three main points I'm going to discuss are risk factors of the disease, stages of the disease, and treatments for the disease. My name is Kristen Benson, and I've been researching this topic for a while now. First, let's talk about the risk factors. Risk for the disease increases after the age of 65, and 1 in 3 senior citizens dies from Alzheimer's, according to the Alzheimer's Association. Women are more likely than men to get Alzheimer's disease. According to the Alzheimer's Association, 2/3 of people living with Alzheimer's disease are women. Family history also plays a role in risk factors. A person with a parent or a sibling who has had Alzheimer's are at a higher risk of getting Alzheimer's disease. Other factors associated with Alzheimer's disease are Down syndrome, although there's no known reason why. People with Down syndrome often develop Alzheimer's disease in their 30s or 40s. According to Dr. Neil Lava, recent studies have shown a link between Alzheimer's disease and head injury. The next thing we'll talk about are the stages of Alzheimer's disease. In the first 3 stages of the disease, patients with Alzheimer's disease show a very mild decline. In stage 1 of the disease, there are little or no memory problems or symptoms associated with Alzheimer's visible. In the second stage of the disease, memory problems start to occur, but family members aren't able to distinguish if this is a normal part of memory loss. In the third stage of the disease, this is where family and caregivers will start realizing that there could be a problem. Alzheimer's patients, they usually start having troubles developing conversations. They start misplacing things like their keys or valuables. In the later stages of this disease, though, it's very easy to recognize the signs and symptoms. In stage 4, the symptoms are very clear and apparent. Patients suffer from poor short-term memory. They're unable to take care of their own finances. In stage 5, they need help with their daily activities. They cannot recall simple details about themselves. They need help getting dressed. In stage 6, there's a need for constant supervision or professional care. They can't recognize their surroundings or the faces of anyone other than their family and friends. And their confusion is more persistent. This is where their personality and behavior really start to show some problems. During stage 7, the final stage of the disease, patients lose all ability to communicate. They may be able to utter words, but they do require assistance with all daily activities, or may even lose ability to swallow. Last, we'll talk about the treatments for the disease. Unfortunately, there is no cure for Alzheimer's disease. There are medications available that can help with cognitive enhancement. Current medical interventions are to help improve behavior and symptoms. According to the National Center for Aging, the FDA has approved certain medications, but they're only effective in the early stages. Those include Aricept, Exelon, and Namzaric. Also, as part of treatment, Alzheimer's patients need help from a caregiver. According to the Alzheimer's Association, approximately $200 billion in care is provided by unpaid caregivers or family. Most caregivers live with the person who has the Alzheimer's disease, and most of those caregivers are daughters of the patient. Today, I spoke with you about Alzheimer's disease. I spoke about the risk factors associated with this disease, the stages of the disease, and the treatments of the disease. This is a disease that is difficult to deal with, and unfortunately, it leads to an untimely death.